everybody. I'm Sonia Jordan, and I appreciate you being here today. What is your vision? What would it be like to gradually lose your vision, progress into legally blindness? That was the life for my mother and my aunt. My mother was 28 when she was diagnosed with retinitis pigmentosa, and she died at age 39 legally blind. My aunt was 26 when she was diagnosed, and she's now 74, living with this disease daily. To be able to help people with this rare eye disease, we must understand how it comes about. So per the National Eye Institution, in facts about retinitis pigmentosa, it is a rare genetic disorder that affects the photoreceptors of the retina called rods and cones. Per Dr. Alex Levin, author of the Will's Eye Handbook of Ocular Genetics, 1 out of 4,000 to 8,000 people are diagnosed with this disease worldwide. He also notes that 1/2 of those cases have no family history that is known to them. It is caused by the breakdown of the rods and cones in the retina or the light sensors by mutations of the cells. There are over 50 cells that can be affected in this disorder. The mutations of a cell hit the proteins of the eye. Some form toxic protein which attacks the other cells, and some are just formed abnormally and limit the function of the eyes. It is usually diagnosed between age 10 and 40, and we see them in kids. Usually they start to be clumsy, falling down, and hitting things. They will become night blind, so they can't see at night, which limits their ability to drive. They will also lose their peripheral vision or their side vision, so they only see what's directly in front of them, which causes lots of injuries. And per Dr. Kirsten Boyd, in an article about retinitis pigmentosa diagnosis and treatment of the American Ophthalmology Center, she notes that cataracts are also formed in these patients. Cataracts can be removed at a later time to improve their vision. So ways that we diagnose it, we have an ophthalmology consult. They'll come in and take an ophthalmoscope, look in your eye. When they do this with retinitis pigmentosa, they see a dark streak across the retina. Also an electroretinogram. This measures the electrical activity of rods and cones. When you do this, the activity is decreased in RP. Visual field testing is done. This measures your peripheral vision or your side vision at the doctors. Well, this is also decreased in retinitis pigmentosa. And then gene testing, this is where they come in and they draw your blood and see if you carry the gene for retinitis pigmentosa. So here is a normal retina versus retinitis pigmentosa. And in this normal retina, you see everything's lined up just the way that it should be. All looks really pretty. And in retinitis pigmentosa, you see the rods and cones are scattered everywhere. There's no rhyme or reason, so we can see why they would be blind. So currently there is no cure for retinitis pigmentosa. We can only treat the signs and symptoms and try to slow down the progression of this disease. Per Dr. Elliot Burson, MD, professor of Harvard Ophthalmology, in a randomized trial of vitamin A and vitamin E supplements, he noted that if the patient took vitamin A at 15,000 units daily, they could decrease the progression of this disease by 20% annually. He also noted that lutein and omega fish oil were also very good at helping to slow down the progression of the disease. Another thing he found out was in vitamin E, that should be avoided in the patients with retinitis pigmentosa, as that increases the progression of this disease. Another treatment that has shown to have some improvement per Dr. John West in stem cell ophthalmology treatment study for retinal and optic nerve disease, he notes that in the stem cell treatment showed that 64.7% of his patients that received this treatment showed improvement in their field after treatment in both eyes. Some equipment that we might use: prism glasses, blind cane, walking sticks, guide dogs to get around, using large print materials, and audio equipment may help your patients. And then also there's a thing called an Argus 2, which is an artificial retinal implant. So what can we do to help these patients? Assist them to be as independent as possible, use large print items for them, keep their equipment readily accessible for them and clean, available to use. Promote safety in their homes by decluttering it, taking out loose rugs, a well-lit area, and keeping everything in its same place for them at all times. So now I have given you 2 pairs of glasses. The first pair I'd like for you to try on, and it shows no peripheral side vision. It takes away that. The second pair is cataracts, and when you put on these two glasses together, this is what it would be like to have retinitis pigmentosa progressing to legal blindness. How does that make you feel? So this is my aunt. She's legally blind at age 74. She was diagnosed at age 28. She has 26. She was diagnosed at age 26. She has all the signs and symptoms of retinitis pigmentosa. She says it happened gradually over years as she lost her vision. She had to give up many things that she loved, such as cross-stitching and singing in her choir and going out at night. Once she says she actually hit the superintendent of Wilkes County with her car because he was in her side vision and she could not see him. It actually broke his hip. She, however, has not let this disease define her in her life. She is still very much active in the community and in the church. So RP disease is a rare genetic eye disorder that has no cure at this time. It leads to blindness. There is currently many investigative therapies in progress at this time that possibly can help. I hope that we find a cure in my lifetime. RP may take your eyesight, but it does not have to take your vision. What is your vision?